Our partnership with Care Logistics has had a profound impact on our patients. They are what I would consider a partner in our patient care, and they are invested in the outcomes we have with our patients and our personal performance here in our market. Inefficient care can lead to delays in care, which at best is frustrating to our patients, and at worst can lead to poor health outcomes and safety events. Efficient care is just more satisfying to our patients, and it also leads to better outcomes.
One of the things I enjoy most about my role is continuous performance improvement. Working on throughput and efficiency, I get a lot of opportunity to identify barriers or opportunities for improvement and actually help direct my teams to implement strategies for improvement. We like to say that efficient care is safe care. Before Care Logistics, we operated in silos. Every department was trying very, very diligently to do the best they could do to be efficient, but there was no coordination among the departments. Now with our hub and spoke model, as well as the technology that we implemented to support the new roles and processes, we have bi-directional communication between the hub and all the different departments, whether that's the ED, the service area, or the nursing units. We've been able to get rid of the white space, so patients are having to wait less for things like testing and consults. They get a diagnosis and treatment started quicker, and they heal quicker and are able to discharge in a more timely fashion, and that ultimately helps our patients' experience as well.
Before partnering with Care Logistics, we were struggling with long lengths of stay for inpatients. A high percentage of our patients were leaving the emergency department waiting room without receiving care. We tried many different initiatives. Without value stream visibility and a progression of care framework, we just weren't able to sustain improvement results. We've really enabled our staff, our providers, our nurses, hospital operations to see and resolve those bottleneck and barrier delays in real time.
I consider myself a system engineer, so when you get to see, how we're doing in a lot of different areas, including status, for example. Our observation patients are across the board in so many different units, and being able to cohort those patients under one unit and making sure that this team is efficient and got the resources that helps them deliver the care that they're here for, and bringing the length of stay of observation unit down significantly by doing so. That's one achievement that was not feasible without the help of the Care Logistics team.
If I had to summarize Care Logistics in just one word, it would be alignment. By partnering with Care Logistics, we were able to align our data, our people, and our processes.
Without robust technology and a good strategy around technology, we're not going to compete as a health system and offer the best possible care to our patients. We have multiple systems, right? You have the EHR, you've got PACS systems, you've got multiple different systems in the organization that it takes to run a system this size. What Care Logistics allows you to do is see the patient journey more holistically and kind of see in between the gaps that otherwise might be missing in between those systems.
The transformation we did with our case management department, the reorganization that was really driven by our Care Logistics partnership, was one of the most challenging things we did, but actually one of the most effective things that we did. By adopting the Care Navigator model, we realigned our RN case managers and our social workers so that now we have folks working on progression as well as discharge, and that's made the biggest difference.
The de-escalation huddles helps efficiency, helps the team in the background, and helps the patient also stay where they like the most, which is outside the acute care setting.
Given the size of the EHR partners that most health systems have, Care Logistics is of a size and a depth of partnership that they really get to know your organization, and they can help you in ways that a piece of software is not necessarily going to help you.
They're there for any time we need support with our current model, or if we want to talk about new ventures, they're there to support us.
Whenever there's a question that we're trying to identify an answer for, before you pull the trigger on developing a whole QI in the wrong direction, you kind of lean on your support there and just identify what opportunities do we have as a system. Their software is really helpful when it comes to translating the processes into meaningful data and setting us up for success.
Care Logistics does not replace your performance improvement department. Care Logistics helped improve our performance improvement department. And so now what you see is at the department and care coordination levels, they're doing performance improvement work every day. It is part of our daily work now. And continuous improvement is woven into the fabric of our culture.
Optimal and efficient patient care is no longer a nice to have, it's a must have. We have to figure out how to be more optimally efficient, to do more with less, so that we are here to care for our communities. We've had significant financial improvements with our work with Care Logistics, and we reinvest all those finances back in just our patient care in our communities.
We're going to continue to grow our service lines, and we are going to expand our capabilities so that we can better meet our mission. I expect that Care Logistics will be a partner in that work going forward.